community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to the show. It's Bobo, 103.1 FM. It's Dane hanging out with you, and each and every single week, we have a special show that's dedicated to all things HSA. It could be a conference coming up. Maybe there's a doctor that's talking about his specialty, or maybe an awareness around a certain subject matter that's very important to the medical field. And this is no less important today. We have very special guests in the studios joining us. As usual, I always have them introduce themselves. Even when we go on break, when we come back, we have them introduce themselves again and just kind of give a breakdown on their name, their specialty, and how long they have been with HSA. So the floor is yours. Whoever wants to, I would always say ladies first. So we'll start with ladies, and you start with introducing yourself and your title and how long you've been with HSA.
Okay, hello. My name is Asharah Walker. I'm a radiographer, sonographer at HSA. I've been with HSA for about 9 years now in the radiology department. I perform x-rays, ultrasound, CT scans, mammograms, and a few other modalities. So yes, it's been 9 years. It's amazing.
9 years.
Yes.
Everybody that comes in from HSA has either been with the company since it started, or they've like literally been there 10 years. No less than, I don't think I've ever interviewed anybody that's been there for 2 years or 3 years or 4. It's like anybody that's seasoned has been there. Oh, so that's you. You're the first one. No, that's a lie, though. I did interview a new doctor to the hospital. He was fresh out of the UK, and he was only with HSA for 3 weeks, max. So, yeah. Oh, I'll have you introduce yourself now.
Hi, listeners. My name is Dr. Sitaram Barath. I am an interventional radiologist at HSA. I have been fairly new to Ireland. It's my 6th month running. So, yeah, fairly new. But I do all kind of intervention related to vascular system, which is your varicose vein, DVT, stroke, tumors, and we discuss them as we go.
6 months. 6 months you've been here on the island. Where were you before?
I was in India before coming here, so I'm straight from India to here. Yeah.
How has the culture shift been for you?
Yes, it's a lot of shift because you see that both countries are poles apart. India is like 1.5 billion people, and this is like close to 100,000 people. Also, you have like university hospitals in India. Here, HSA is a different setup of hospital, so it's different. But in the end, we all do radiological imaging and we treat patients with the diseases, the same demon we are fighting with at all the places. So it boils down to taking patient care and providing the services to the community.
Yeah. Do you find it's like a little bit more fast, less paced than it was in India?
Yes, it is slow paced because of the nature which comes with the island nation. It relies on so many things which comes from outside, but it's a different experience altogether, and both things work in a different way. So I'm enjoying my time over here. I'm sure that I'm helping the community in a betterment of their health.
Indeed you are. Definitely you are. And especially with this subject matter that we're going to be celebrating today. In the week of November 2nd and 8th, you guys actually have a week of celebration for radiologic, technological Week 2025. Is that right? Did I say that right? Whereas
Yes, it's Radiologic Technology
Yeah.
Week. Yes.
I love it. Explain, because it sounds very familiar. If you left me to explain this on the radio today, I would say it has everything to do with my job, but it's not. So go ahead and explain what this week is all about.
Okay, so this week we're celebrating Radiologic Technology. It is the whole arm of radiology, actually. And radiology is the imaging of various parts of the body for diagnosis and sometimes for minimally invasive treatment. That's where Dr. Barath comes in. He's the interventional radiologist. So he does more treatments than diagnostic studies, right?
Yeah.
And today we're celebrating, this week, we're celebrating the professionals who are a part of the radiology department, the radiologists, the radiographers, the sonographers, the MRI technologists, the CT technologists, and if we are going to go into all the modalities, it's going to be very vast.
Yeah.
Yes. And actually this year is 130 years since the discovery of X-rays, because X-rays were discovered November 8, 1895, and we always use the week that incorporates November 8th to be the Radiologic Technology Week. And we have the International Day of Radiology on November 8th.
Okay, that's amazing. And this is a very important subject matter, because the things that you listed down that has to do with this department are very important. I found it out recently because my wife was having some severe back pains and she had to do MRI. And when she went to go and do that, it was very sophisticated what had to be done, because she was placed in the room and she had to go in this machine and she couldn't move for a span of 1 hour and 30 minutes, I believe it was. Why is that?
Yeah, so whenever we acquire some images or pictures for that matter, so if you move, you get a moving picture, right? So you get artifacts which are called motion artifacts. So as still a patient is, we get better pictures and we get more accurate diagnosis of the diseases. So that's why we ask the patient not to move, or we also control their breathing patterns to get good images, because sometimes what happens in the chest or in the abdomen, even with your breathing, the organs move. So you will get a picture which is more blurry and you don't get the information as you want it to be. So we control their motion, although it is irritating maybe sometime to the patient, maybe overwhelming for them, because the first time going in the machine, which is looking like kind of a scary thing, and they might have claustrophobia. Many of them have.
Yeah.
They're scared of closed spaces. So, but we simulate the experience with them, and then we do the breathing exercise with them, especially for the cardiac CT or MRI, abdomen MRI, where they are allowed to breathe in a certain way, so that we control that and we get good images and a good diagnosis.
Yeah. You know what? She said that she never had to scratch so much in her life when they told her she had to sit for like a...
Your nose never itches until you have to stay still.
You tell, I'm
Right?
fine getting into the machine, but you tell me not to do this, and it's a problem. Like, I give you an example. I went to do, I forgot what it was called. It was like, basically it's referred to it as an ultrasound for men, I guess, to do a check. I hope I'm saying this right. I'm no doctor, guys, or no specialist in this area. But I just remember the guy said to me, okay, drink 3 glasses of water, and I need your bladder to be full before you arrive. And I said, that's fine. It's completely fine. I usually drink water every single day. I don't need to go to the bathroom until 2 or 3 hours. And I was going to see this guy in about 30, right?
Yeah.
Mm-hmm.
Oh, my goodness. It felt like I just needed to go in that instant. So I feel like it's a mind trick that when it's played on your body,
so
right?
most of it is mind, because when you are busy and you're doing your thing, you don't even concentrate on those aspects. But when you're sitting in a quiet room and you're waiting, there's the only thing which is coming to you is, gosh, once the scan is done, I'm going to go use the washroom, and then that was gets onto you and it does the mind trick to you. Yeah. Your brain is much more powerful than you think. Yeah.
Yeah, it is very much. I found that out. Now, guys, let's talk about a very important subject matter. Let's talk about patient safety. Let's talk about how we approach these things that can be done in the radio technology world. But also, there might be some people that are very skeptical about MRIs, ultrasounds, X-rays, and they go in, they see this big yellow icon that says, what's the word I'm looking for? Yeah, radiation. That scares me. It terrifies me. So let's talk about patient safety when you guys take on your role. How important is that?
So we follow in imaging. So there are many aspects of imaging. So we use radiation, which is in X-ray and CT scan and fluoroscopy, which is like X-ray radiation. So that's harmful. But we use a principle called Asharah principle, which is as low as reasonably achievable. So for any diagnosis, say for chest X-ray or a CT scan, we use minimum dose which is appropriate for that patient. Now machines are now very intelligent, so they will calibrate the dose based on what is the body habitus of a certain patient is. So they will use the minimum dose which is required for that patient. So that is the Asharah principle, which is all over the world, which is followed.
And what is it referred to as again? Say that word one more time.
It's called Asharah, which is
Asharah,
as
okay.
low as reasonably achievable.
Okay, wow.
So you get the information right with minimum X-ray dose, which is appropriate for the patient. And then for ultrasound and MRI, they don't involve ionizing radiation, which is X-ray radiation. So those are quite safe in the prescribed limit, and they all come with extensive research and FDA clearance, and then only they will come to human beings. So they are safe, and we follow standard guidelines, which are accreditation guidelines from JCI and all radiology societies, and we follow those guidelines to say that these imaging are safe.
Yeah.
And if there is any danger from the imaging, we let the patient know, especially if it's like a young kid or a pregnant woman, and then we know that these things can be harmful, and then we exercise precautions.
Yeah. Anything you want to add, Doctor?
The Asharah principle actually incorporates three aspects mainly: time, distance, and shielding. So with keeping our patients safe, we keep our exposure times to the radiation as low as possible. And the most important thing that we want to do, we want to keep it low enough to get the best image for the patient. So, so depending on the study, your radiation exposure might be increased. For example, an X-ray, very little radiation, but a CT scan will be more radiation because of the detail that we need to get from that study. So that takes into consideration time and distance. You notice that when you're doing an X-ray or a CT scan, the persons doing the study will be away from the field of radiation, and we don't allow persons who are not doing the studies to be inside the room because we want them to be away from the radiation.
And that's the part that scares me, because you guys are not even in the room. So I'm like,
we are in the room, but then the next principle is shielding.
Oh,
yes.
So you guys don't go, or is it done differently in different hospitals? Do you guys not go behind a certain room, or is you guys stay in that room? Is it the same thing? 'Cause I feel like it's different depending on the hospital. Am I wrong or right? Or am I watching too much TV?
You're probably watching too much
TV, right?
but the rooms are constructed to have a glass shield, really. So it feels like it's a different room, but it's the same area.
Yeah.
Right? And we have to protect ourselves, because you might come in to have one CT scan done, and that's the only CT scan that you're gonna do for the time that you know.
Yeah.
And we do like 10, 20 CT scans each day.
Yeah.
So we have to shield ourselves from the radiation, and we have to make sure that the patients and the general public are shielded. So all the rooms that we do the X-rays in are lead lined. Lead is the gold standard in radiation protection, because it effectively blocks radiation from progressing past it. Yes.
Okay. Yeah, this is a tough job you guys going to do every day. It's not an easy one.
Yeah. On the other aspect, you were talking like you are in the room. So I do vascular intervention, which is the fluoroscopy you see on the machine, angiography machine. And I'm standing there because I have to deliver therapy, so I can't deliver from outside the room.
Yeah.
So, but I shield myself from the lead apron and lead goggles and a lead cap and a thyroid collar and gonad shielding, so that I don't get as much radiation, because I'm doing it for like living, so every day, and the patient may receive that
Schwanz.
for
Yeah.
once, maybe.
Yeah. Yeah.
Yeah.
So that's the thing, yeah.
Yeah. It's a tough job. Tough job. Guys, we're going to take a quick commercial break. When we come back, we'll discuss more just around this important topic today, an important week, important education topic. And we're also, before we end the show, we're going to speak to a lot of the students that tend to listen to this radio show, especially the medical students or future medical students, that this may be something that they want to explore. I find that a lot of people that want to get into medicine, they usually message our Instagram a lot to ask questions to the doctors and just how they can get involved or any mentorship program. And of course, patients that want to know about referrals. So we'll talk about that. And my favorite subject matter, AI, and how is it going to advance in your field, coming up. So keep it locked.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
All right, welcome back to the show. It is Bobo 103.1 FM. Dane hanging out with you this week, and we are back with the next episode, all courtesy of HSA. We have some very important doctors here in the studios today, and we're celebrating Radiologic Technology Week 2025, all from starts from November 2nd all the way to November 8th. And it's my honor to have them here in the studios. I'm going to have them introduce themselves once again. Guys don't have to say how long you've been with the company, with HSA, but you can just reintroduce yourself. We'll start with ladies first.
Okay, my name is Asharah Walker. I'm a radiographer and sonographer at HSA.
And myself, Dr. Sitaram Barath, I'm an interventional radiologist at HSA.
Guys, thank you so much for joining the program. Earlier, before I took a break, I did say I want to bring up the important topic around AI. I know this is a very sensitive topic for a lot of people because some believe in the new technology of AI, and some are saying, this may be a disadvantage for me, may take my job, something I'm scared of, something I don't understand. So we'll see what you guys think and if it aligns to the future of your career. For me, I guess I will start it off by saying I once did a doctor visit for a prostate check, and didn't have to be as serious as I thought it had to be because it involved an AI machine. It was doing it for the radio station, and I was like, what are you talking about? And I don't have to do it the regular old school way. And he was like, no, I'm serious. We're going to do similar to an ultrasound. We're going to check your prostate that way. How safe is that? And is that something that we can depend on, knowing that? Because the way I look at it, when I get my prostate checked that way, it's like me saying, okay, well, let me catch a barracuda and put a piece out and hope that the ants tells me if it's poison or not. That's how it kind of feels, because I'm dependent on AI to tell me if I have prostate cancer or not. And that, to me, leaves me a little bit nervous.
Yeah, so the nervousness is okay, and we do understand that, you can't believe somebody say, some computer is going to say whether I have it or not. We still believe human decision, like most of the time. So all AI are still, it's not like a final report which comes from AI. Of course, it is always seen by a radiologist who approves these reports, and even the AI says this is an AI generated report and a radiologist's opinion will be final. We all are using AI in our life, and especially in radiology and imaging, we are using AI. It's helping us. It narrows down, the critical areas. It points out things where we have to look in more detail and finding stuff out. We already using AI in HSA for X-rays and all. But of course, a radiologist has to see before the final report goes out. So it's not replacing a radiologist, it's not taking their job away, it is just helping them.
Yeah. Well said.
And from the imaging perspective, AI has been very helpful because it helps to reduce the radiation dose that we give to the patients because it's helping to improve image qualities. Sometimes with different parts of the body, we can have artifacts and the AI can fill in some of the areas that we miss.
Yeah.
And it improves image quality, reduces the radiation dose, and gives us more clearer images so that we can have better diagnosis.
Yeah. So sorry, go ahead.
It's been really helpful in the field of radiology.
Yeah. I mean, the doctor I did it with at a time felt like this was a groundbreaking technology, and it was able to, obviously he was very straight up by giving me a statement saying that, look, this is not 100% accuracy. It helps. It's a part of the solution on how we can figure out things and seeing if we need to do a detailed check. Yeah. But it was a way of, obviously, because a lot of men are not showing up to hospitals anymore because of old school way of checking this. And if AI can bring a lot more men in and reduce that fear of checking their prostates, like just simple tests like a blood test, then it's similar, right? You come in, you do a simple ultrasound, and it's helpful. I, at the time, because it's new to me, I just didn't understand, because you guys are the experts. You have to read the scans after. I didn't know how effective it was doing it that way. So, that was my feedback.
Yeah, so you can scan and the AI can read the reports, or sometimes AI will tailor the scan for the particular patient. And as you give more and more data to the AI, they will become more and more smarter, and definitely, probably that will be the way out in future. But at present it is strictly controlled by guidelines and by humans. Yeah. But we don't know. Maybe it will change in future. Yeah.
Absolutely. And you guys are now exploring that technology at HSA, right?
We're using,
Okay. Perfect. So I hope a lot of future patients are hearing that. So, guys, thank you so much for being a part of the program today. We definitely enjoyed the conversation. Short, but just to the point. And congratulations on celebrating your week this week. All right, guys?
Thank you for having us.
Thank you. Pleasure.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.